All right, here at 5:30, Indiana, like many states, is really grappling with poor outcomes for mom and babies.
In fact, Indiana, one of the leading states that struggles with both infant and maternal mortality. This is something that we have battled for some time. And it's despite recent data that shows the state's infant mortality rate is improving. In fact, right now it is at a record low.
Jenna Webster shows us how a pilot program is helping turn those numbers around.
At 2 years old, sometimes you need a little help to get through the day.
Put you up some more.
Like most moms, Ethel Harmon would do anything to keep her 4 kids happy. But moms need help too.
It was hard trying to afford bills, rent, and thinking that a baby is about to be born. So I wanted to be proactive.
She's not the only mom who's struggled to pay her bills.
And that's easy to happen. 1 or 2 payments behind, and you can be in a situation where you don't know how to provide.
Indianapolis renters face some of the highest eviction rates in the country. Last year, for every 100 renters, landlords evicted 14.
Eviction rates disproportionately impact moms with children under 5.
For pregnant women, that comes with dangerous consequences.
We see a greater incidence of prematurity, a greater incidence of needing intensive care as an infant, and even into childhood, we see greater conditions like asthma and other chronic conditions.
Camille Ray with CareSource and IU Health have worked the last 3 years to improve healthy outcomes for mom and baby. By helping 50 moms-to-be, like Ethel, get stable housing, rental assistance, case management, and legal assistance for evictions. And the Healthy Beginnings at Home program is working.
We're at 80% full-term births, greater birth weights, more prenatal visits, more well visits after delivery, and more engagement in Medicaid services and community services as well.
Paige Clemmy thought 3 years ago the biggest barrier to stable housing would be rising rent prices. But they found many pregnant women are living in uninhabitable places, some with radon exposure or lots of pests.
They were trying to make the payments, but they ended up either losing their job because they themselves were getting sick from the living environment, or their children were getting sick, and so they were having to take days off.
She says housing, that basic human need, saves lives.
When you don't have to worry about those things that you have to worry about, you're able to provide a healthy cooked meal for your kids, 3 times a day, not just once.
Now Ethel's baby Amir is growing up, exploring with mom and his older siblings, a happy and healthy toddler. In Indianapolis, Jenna Webster, 13 News.
All right. Healthy Beginnings at Home is coming to the end of its pilot program grant funding next year. CareSource says it is working with IU to find other funding sources and is hopeful to expand the program to more moms in the future.